Every child with drug-resistant epilepsy should be considered for a comprehensive evaluation and is therefore a potential candidate for epilepsy surgery. The real barrier in the society, even more importantly, among physicians. We need to stop thinking of epilepsy surgery is a last resort.
Welcome to Epilepsy Smarts Insights. I'm your host, Tori Robinson, and today with epileptologist Juan Perez, we are looking at paediatric epilepsy surgery in Colombia and across Latin America, an area many in higher income countries don't often see in detail. This conversation challenges some common assumptions. Paediatric epilepsy surgery in Latin America is not new, but there are major challenges around access, referral, training, and long-standing misconceptions, including within healthcare systems. We're going to talk about why so few children who could benefit from surgical evaluation are referred, why delays still exist globally, and why education across clinicians, systems, and society is critical to improving outcomes. If you're new here, please subscribe so that you don't miss future conversations. And let's get into today's episode, presented in partnership with Easy by Prosthesis GmbH. Many of our listeners in high-income countries probably have not thought much about what paediatric epilepsy surgery looks like in Colombia or across South America, Latin American countries. So what would you most want them to understand about the care, expertise and progress that already exists there?
I think maybe the people living in high-income countries often assume that we either don't have the capability to offer this type of treatment at all, or that it is done in a very precarious way. However, that's not the reality. Pediatric epilepsy surgery in Latin America has been performed for decades, admittedly on a smaller scale, and despite our limitation, we have steadily grown over time. At the same time, there are clear differences between countries within the region. Countries such as Brazil, Argentina, Mexico, Chile, and more recently, Colombia, likely lead in performing pediatric epilepsy surgery. And this is closely related to the availability, technical resources, and most importantly, the number of training professionals.
People make presumptions about countries and continents that they're unfamiliar with, which are often very unfair and inaccurate. So it's great to hear about what you are doing in your country and across the continent. About 80% of people with an epilepsy actually are in low to middle income countries like Colombia, right? And a lot of people are shocked about that. And you've also told me that only around 0.5% of children suitable for epilepsy surgery are actually referred by their neurologist as potential surgical candidates. Why is this? And could you put this percentage in context for us?
The reality is that globally, about 30% of people with epilepsy, regardless of age, have drug-resistant epilepsy. We should also remember that in United States, the patient with epilepsy can take more than 20 years to be referred to comprehensive epilepsy program.
The same in the UK and Australasia. It's crazy, absolutely crazy. 2 decades.
Here in Latin America is a very little amount of epilepsy surgery programs. Fortunately, this delay is shortening children, but even then, it still represents a significant loss of time. In our settings, the situation is even more challenging, as the number of institutions or specialized centers is much lower than high-income countries. Even now, in the era of precision medicine, many people, not only Latin America, but worldwide, including healthcare professionals involved in the care of these children, still hold misconceptions of medicine, such as believing the epilepsy surgery is extremely risky or that outcomes are poor.
And why do the neurologists think this, though?
The neurologists who are training in institutions where the epilepsy surgery is not known.
It sounds like we usually sort of blame, if that's the word, patients and families for not taking up the opportunity or referring themselves or looking into epilepsy surgery. But actually, in some cases, as you're saying, it can actually be the neurologist that doesn't doesn't refer a patient?
The opportunity is there. Every child with drug-resistant epilepsy should be considered for a comprehensive evaluation and is therefore a potential candidate for epilepsy surgery. The real barrier in the society, even more importantly, among physicians. We need to stop thinking of epilepsy surgery is a last resort.
So what are you doing, though, you and your colleagues doing to try and overcome this fear amongst the clinicians?
In my view, the key to addressing this barrier is education. Education at multiple levels, starting with society, the neurologists, the families, the politicians, the healthcare system, all people involved in them who are treating a child with epilepsy, increasing awareness about the disease, working to eliminate the stigma and making existing treatment options more visible.
Before we move on, with thanks to Easy by Prosthesis GmbH. Tell us a bit about the work that you're doing to try and achieve this, because you work with, for instance, charities and you work in educating other clinicians. What else do you do?
Right now, I am trying to do or create some campaigns to educate the people in all levels, in all cities, in all neighborhoods, maybe in the schools. It's essential to educate policymakers and the health system so they understand that if the children with drug-resistant epilepsy are evaluated earlier, they will very likely have better outcomes.
And improve quality of life.
This will positively impact their future, their quality of life, and of their families, while also benefiting society and improving the use of the resources. And finally, but just as importantly, we need to ensure that not only Latin America, but worldwide, training programs for both technical and university-level healthcare professionals include epilepsy in a much more comprehensive way. Even in medical training, sometimes a single hour in the entire program is dedicated to epilepsy.
That's nuts, and I've heard this in multiple countries. It almost doesn't matter the income or GDP of the country. Epilepsy is so rarely looked at enough. And like you're saying, we need to start from education level within universities as well when we are training clinicians.
It's totally real. It's a bad situation across the world.
We can change things slowly, but surely, which you are helping us do through education, you said, and being involved in politics even. I think it's really important. We need to explain to people how this is going to benefit other people within our countries, not even solely the people with epilepsy. You've done a couple of very related papers on this topic of education called, I'm reading this out, Fellowship Education in Epilepsy in Latin America and Africa, Results of a Survey, and the Challenges of Establishing Centers for the Surgical Management of Epilepsy in Low to Middle Income Countries. Basically, education is lacking in these geographical areas. Mm-hmm. But you are helping to create the first in Colombia academic pediatric epilepsy training program. So how are you doing this, and what are you doing differently to other forms of training? Okay,
in Latin America, training programs for epilepsy are generally scarce and mainly are concentrating in countries like Brazil, Mexico, and Argentina. There is only one formal training program in neurophysiology and epilepsy located in Bogota. Most physicians specializing in this field have had to travel abroad, especially to United States or Europe for training, which is also costly. The goal now is to develop more training programs focused on pediatric epileptology, adapting to our logistical realities, at least at the basic level, maybe to EEG, basic, MRI, yes, but relying on international institutions for access to more advanced technologies like stereo EEG, like neuromodulation. But our role is to actively inspire the next generation of epilepsy specialists while tailoring educational curricula to fit our local realities and resource constraints.
What's a really cool, positive, constructive challenge that you are overcoming?
Here, not just in Colombia, but across Latin America, we need to have resilience and persistence. We have learning to work with limited resources, while in the literature are important. It is equally important to adapting our reality to our reality. And in that point, the collaboration becomes essential. We need to recognize that it's this, and will continue to be the key tool for our development in this field. Supporting each other and continuing to benefit from international collaboration is fundamental. We have fewer opportunities to publish, but we have to keep moving forward in our day-to-day work. And also, despite technology and workforce limitation, we have done well. And we will continue to grow step by step.
Thank you, Juan, for such insight. A key takeaway from our chat is that the challenge is not just about whether services exist, it's about access, referral and capacity. Even where expertise is present, it is often limited, unevenly distributed and difficult to reach. We also see that delays in referral are not unique to one region. Even in high-income countries, people can wait years or even decades to be considered for specialist evaluation. What comes through clearly, though, is that misconceptions around epilepsy surgery remain widespread, including within parts of the healthcare system, and that has real consequences for whether people are ever referred in the first place. This is why education matters at every level, from universities and clinical training right through to health systems and policy. And importantly, this is a story of a gradual process. Services are developing, training is increasing, and clinicians are working to build capacity with real restraints. There is a clear opportunity here, both locally and globally, and that's to improve earlier recognition, referral, and access. Thank you to Easy by Prosthesis GmbH for sponsoring this episode. If you found today's episode interesting, please give it a like and subscribe, and hit the bell so that you are notified when new episodes drop. I would also love to hear your thoughts or experiences in the comments below, and I do actually read them. Thank you for joining us, and see you next time.